Congratulations again on being awarded the 2015 United Health Foundation NMF Diverse Medical Scholars Program. And for those of you who are renewing, congratulations as well. Okay. So for those of you who don't know, our tagline is changing the face of medicine. NMF awards scholarships to underrepresented minority groups. This includes African American, Hispanic, Latino, Native American, Vietnamese, Cambodian, Pacific Islander. And our primary goals are to achieve health equity of opportunity in medicine, access to quality health care for all, to increase the number of minority physicians, and to change the face of medicine to better reflect and serve our diverse population. This program is generously funded by United Health Foundation. We're a little bit of a unique program compared to other programs that NMF runs because we do allow for students to renew their scholarship every year that they are in medical school, provided that they meet all the program requirements and are in good academic standing. So we do have a number of you guys on the phone today. Unfortunately, as I mentioned earlier, a number of our colleagues could not make it. So for those of you who are on the phone, I'm going to unmute you. So if you have things going on in the background, I ask that you quiet them down. And I would like for the renewal students who are on the line to introduce themselves, as well as talk a little bit about their project and how their project has changed from the previous year. So hold on one second. Ashley, are you on the phone?
Yeah, I'm here. Can you hear me?
Yeah, I can hear you now.
Hi, hi everyone. I'm Ashley. I go to school in Atlanta, Georgia. I go to Emory. I'm a fourth year this year. I'm renewing my project this year. Last year, I worked with a free clinic that I used to run as a first year to implement HIV testing for free for women who were interested in it, because we noticed a lot of our patients coming in for OB-GYN services were coming in solely for HIV testing, or were also wanting to be tested and weren't sure where else to go. So we worked with a local organization to make sure that we could do testing 2 times a month, and so that's kind of what we worked on last year, and it's been going well so far. It's been over a year now. But we realized that a lot of our clients, or really very few of our clients, were Spanish speaking, and given where we are in Georgia, we have a very strong Latino population, and so we felt like we weren't really reaching out to them. So what we're doing this year is trying to look at the feasibility of having Spanish-speaking clinics every month or 2, so that we can sort of cater to Spanish-speaking populations and attract them to our clinic, and to kind of assess what resources they have for women's health, and particularly HIV testing and counseling. So that's sort of what I'm doing. I'm hoping to implement a translator service, interpreter service to our clinic, and then also compile a list of not only HIV resources for women in Atlanta, but have this information available as references in our clinic in both English and Spanish. So that's sort of what my project is.
Thank you, Ashley. Let's see, what else we have? Chi, are you on the line?
Yes, ma'am. Can you hear me?
Yeah, we can hear you.
Okay. My name is Chiameka Anyama. I go to Drexel University College of Medicine in Philadelphia, Pennsylvania. Last year, my project was mainly focused on the aging population in northern Philadelphia, more specifically in Maple Village. It's a small outreach that helps those elderly clients, they don't like me saying patients, but clients that are really sick and that can't really take good care of themselves and watch their healthcare progress or manage their healthcare. So I basically go in, cross-reference the drugs that they're taking to make sure they're not taking any contraindications. I do home and safety checks, and I also assess their physical activity as well as take a history of present illness from my records and basically send any red flags I see to the representatives at Maple Village or at the outreach. This year, I wanted to really broaden the scope of my project. I joined up with a fellow classmate of mine, Justin Ocons, and basically we wanted to more specifically address health literacy because I felt that was the issue plaguing a majority of the clients that I met last year. They didn't really understand what was going on with their health care. They didn't understand what their drugs were doing to them. So this year we're focused on meeting personally with about 20 to 30 clients who are taking more than 10, who are taking 10 or more meds, as well as building a pamphlet to be sent out to more than 250 of their clientele spread out throughout the whole of North Philly. Finally, we are going to create, or we are in the process of creating a health literacy event whereby we bring in as many clients as possible to, use fun activities to educate them on what their drugs are doing and not to write them off as, oh, just simply ailments of aging. A lot of them don't know that their drugs cause them to be dizzy and make them fall and stuff like that. So we're just trying to educate them, decrease their comorbidities, and hopefully, impact the community in a positive way.
Thank you.
No problem.
And so the rest of our renewal students are actually all in class right now, so we'll be moving on to our entering students. Raphael?
Hello?
Hi.
Can you hear me?
Yeah, we can hear you.
Hi, I guess my name is Raphael Harris. I'm a first-year medical student at FIU, and I guess my project is more geared towards the lines of, I guess, working with youth in terms of trying to do youth empowerment and exposing youth to science and mathematics. So, I've teamed up with a local after-school program in Carroll City, which is a really distressed neighborhood in Miami. And it's my goal to, to help, supplement the poor academic standards in the area at the same time, and increase exposure, in terms of like health and medicine and stuff like that. So, basically, it's like I try to start an enrichment program for at-risk youth. So, I have a lot of questions for some of the older guys, but I guess I'll let everybody else finish. So that's pretty much so far what I have to say.
Thank you. We have Justin. Justin?
Yes, I'm here.
Hi.
How you doing?
Hi.
Yeah, so this year, as she was stating earlier, I teamed up with him to kind of make his project a little bit broader in the scope of his project. This year, I think we're going to connect individually between both of us with at least 20 different clients, and pretty much do everything he did last year as far as assessing their homes for any type of things that may injure them, for falls or rugs and things of that nature. But also review their drugs. A lot of them are taking drugs that are contraindicated because a lot of them have multiple physicians, and sometimes those drugs aren't cross-referenced. So we typically go in there and we'll check all their drugs and make sure none of their drugs are contraindicated. And another thing we have found that a lot of them are on herbal supplements, and some of these herbal supplements are contraindicated with some of the drugs their physicians have prescribed for them, such as a lot of them take red rice to lower their cholesterol levels, and that's a direct contraindication with statins. And some things like that, things that we try to catch and make sure that they're not doing themselves harm in the process of trying to do themselves good. We plan on doing a workshop when we kind of illustrate what some of their meds are doing for them, because lots of times we have met with clients that have complained that they don't really understand why they're on certain medications. The physicians don't really explain to them why they're taking this medication or that medication and what it's actually doing for them, besides sometimes making them not feel the best, maybe making them feel dizzy or having a dry mouth. So through that workshop, we plan to address these issues in a fun way and make it easy for them to understand what it is exactly that their medications are doing for them and the benefits of them continuing to stay on a consistent drug regimen.
Thank you. Christian? Christian, are you there?
Hello?
Hi.
1 second, sorry, my audio is... Okay, can everyone hear me?
Yes.
Okay, I apologize if I come in and out. I'm actually at my research office right now. So I'm a rising fourth-year medical student at Icahn School of Medicine at Mount Sinai. I'm actually in between third and fourth year. I'm doing a research fellowship in the orthopedic trauma department right now at NYU, but my project is based out of Mount Sinai, and it's part of implementing a student organization called Medical Students for Haiti. Its main emphasis as part of the NMF scholarship is a project in which a group of medical students interested in global health and also in health disparities are partaking in an elective that myself and a few other medical students and faculty have coordinated, focusing on cultural competency with an emphasis in the Haitian community, and then emergency medicine skills in a train-the-trainer program. As part of that, a set of 8 medical students will be traveling to Haiti in March, training a group of Haitian medical students in basic life support and emergency medicine skills, being certified by the American Heart Association. We're also incorporating a research project in which we do a pre-exam and a post-exam for those students to measure the efficacy of the module. And locally, we're pairing up with the Haitian American Community Outreach organization based out of Flatbush in Brooklyn in order to connect with the local Haitian community in New York. New York has the largest proportion of Haitian diaspora in the country. Sinai is situated in East Harlem, sort of a fault line between the Upper East Side and the relatively poor East Harlem community, where patients of all ethnic backgrounds, including Haitian background, come. So we're trying to sort of pair with that organization in order to increase cultural competency in these medical students and hopefully culminate in a health fair in Flatbush. And that's what my project primarily consists of right now.
Thank you. And Alka, are you on the phone?
Yeah, can you hear me?
Yeah, I can hear you.
Hi, I'm Alsha. I'm from Morehouse School of Medicine, and I'm in Atlanta. I'm working at the Healing Community Center. It's a federally qualified health center, FQHC, and basically we're doing a needs assessment because we want to see why individuals in this population, primarily African American and Latino, and they're medically underserved population basically, why they aren't utilizing free to low cost health care. And so basically we're going to be focusing on awareness, and we're going to look at awareness as in means of adhering to cancer screening guidelines, and we're looking at awareness and technology use and if that would increase or decrease adherence and utilization of FQHCs or free or low-cost health care. And right now we're in the collecting data phase, which is difficult in this population. We have a Spanish-speaking assistant that comes with us to get Spanish-speaking surveys, as well as just going to different locations in the neighborhoods, like laundry facilities, rec centers, stuff like that, to get as many surveys as possible that can be representative of the population. So that's where we're at right now.
Thank you. Okay, thank you all for sharing what your projects are. So now a little bit more, I know you guys are already started, a little more information about what is expected of you by the end of the program. So this is what we're talking about, the overall requirements, how you'll be submitting, and then our culminating meetup. So all of you guys have submitted the acceptance requirements. Thank you for that. And so I've submitted requests for all of you to have received your first payment. If you haven't received your first check yet, you should receive it by the end of the week. And by the end of the program, we require a couple of program deliverables. The things that you'll be submitting to us in writing are a 5 to 10 page paper on your project, a PowerPoint presentation. Some of you will be asked to present on your projects, and we ask for the first draft by May 1st. You'll also have to do a poster, which we'll provide the details for a little bit later, and then we'll be having a culminating event where some of you guys will be presenting. We ask that all the students are in attendance. This year it'll be held in Atlanta at the Morehouse School of Medicine on Wednesday, June 17th. Each month we ask that you submit journal entries into Canvas. In these journal entries, we ask that you provide your program activities, so any benchmarks you've reached, mentor meetings, how frequently you're meeting with your mentor and how, whether they're in person or via email, any significant project updates, like the number of hours you've completed, and any personal reflections. For students who are entering in the first year of the program, you are required to do 200 hours of service at your site. For those of you who have renewed your scholarship, you no longer have a minimum hour requirement, but we would like to know how much time you're contributing to your site, to your project, whether it's on-site or off-site during research. And all this information is submitted each month through Canvas. The next monthly update, so the one that's submitted in the beginning of April for the month of March, is what triggers your next payment. So in order for you to get your second disbursement for the scholarship, you have to submit that update as well as any of the previous requirements that were required before this. We've also added this year's Scholar Spotlights. We had Karen Mendez speak last week about getting around IRB. We're going to be having a presentation on replicating a project, so taking a project you've done either in the past or that you're working on now, and then replicating it in a new city. So let's say you're working on a project and you're thinking about when you go to residency, you want to continue working on the topic, the things you'd be mindful of when you're replicating your project. And then beyond United Health. So this session will be on students who have taken their project and have used that to either to build upon, to go to conferences, things like that, talk about things that you might want to consider getting published, things like that, we'll be talking about during this session. And the reason we've added this component from the program last year is because students, we read your journals, and some of you guys had questions about things, and if we see them come up more than once from more than one student, then we'll try to figure out a way to address them. And so these were the topics that we came up with this year that we hope will be able to help you not just with your projects, but overall in your career. For the written paper, as I mentioned, the first draft will be due May 1st. We will read over them, provide you with feedback, and we ask for the final report to be due by May 15th. This year we have provided you with a template to use to help you organize your paper, and that can be found in Canvas under the files in the orientation packet. There's a section of templates that we've provided for the paper, the PowerPoint presentation, as well as the poster. So the first draft of the paper is due on May 15th. We also asked for the PowerPoint presentation, but we asked for the paper first because that's really the bulk of where you're pulling your information from to complete your PowerPoint presentation. It should not exceed 10 pages with your appendix, with your charts, with your pictures. All of that should be included within the 10 pages. We ask this in Times New Roman 12-point font, and that you appropriately cite any references that you've used. It helps us a lot to be able to see what you're doing, so include direct quotes from participants that you've worked with, as well as photographs if you're able to take photos at your site. The 5 parts of the paper should be the introduction, methodology, the findings, conclusion, and then discussion and recommendations. And here's some more information, a little more detail about what is included in those. And those are also included within the template that we've provided for you. For the PowerPoint presentation, we we ask some of you, the fourth-year students who are graduating, we're going to be working with you to present during the culminating event. And we want you to be mindful of the presentation because we want it to inspire conversation during the culminating event. Also, for everyone else who is not presenting, your PowerPoint presentations are going to be used for the public. We put all of your PowerPoint presentations in our resource library, which will be available for students who are interested in applying to the program and be able to see sample projects. We're still pulling together the resource library, but something you should be aware of is that even if you aren't asked to present during this program, it is something that is going to be used and be distributed publicly. We ask that you keep your presentation well organized, use bullets to focus on the main points, and of course visuals, lots of pictures when you're presenting. In addition, just as we did last year during the culminating event, all the students will be asked to complete a poster, which will be on display during the culminating event at Morehouse. We provided a poster template for you to use as well. It can be based off of your PowerPoint presentation, and again, the more visuals and charts that you use, the better. The culminating event will be Wednesday, June 17th. We'll be providing you with more information via email about parking and actual room location. But as I mentioned, during the culminating event, some of the students will be presenting, and we ask that during the presentation that you listen carefully and ask questions. We want it to be interactive. You'd be surprised at how many of your projects are actually similar to each other, and you guys can learn from each other. So this is a chance for you guys to get to know each other as people, as well as being able to bounce ideas off each other in terms of your project and your future careers. Throughout the course of the program, NMF is on social media, and we ask that if you guys are working in an environment where you're able to share what you're doing, that you use social media and you tag us during that. So we're on Facebook, we're on Twitter, we're also on LinkedIn, and our sponsors are as well, and they love hearing about what you guys are doing, as well as being able to see where their investment is going. So you can tag our sponsor at UHG Gives, for United Health Group Gives, which is their foundation, as well as you can tag yourself as NMF Scholar in your activities. We can find you. We won't follow you in your social media, but we like to know what you guys are doing if it's related to NMF stuff. And then, of course, we ask for program evaluation. All of you have been required to do a pre-program survey. We ask for one from yourself as well as from your site to ensure that you guys are kind of on the same page. If you're working with someone else, you guys are both required to do the survey. And your mentor, if it's the same mentor, is required to do one for each of you. And then there's a post-program survey, which should be completed after the culminating event in June for yourself as well as for your mentor. Your mentor submission of the post-program survey is required in order for you to receive your last payment of the scholarship. And then program progression. So this program is one that's unique because it does allow for renewal. So anyone who successfully completes the program, is in good academic standing, who's an M1, 2, or 3 currently, can reapply for funding next year. If you are taking time off and you haven't actually graduated yet, so you're an M4 but you'll kind of still be an M4 because you haven't finished your degree, you also are eligible to renew your funding. In June, after the program closes and we've closed out this program, you'll be requested to submit a new proposal. And we ask that you are exploring a topic that is similar to what you've worked on in your first year. But if you find that you totally, completely are not interested in that topic anymore and you want to change focus, that's fine as well. You can still apply for a renewal of your scholarship, but we ask that you explain why you switched focus and how this participation in this program or this project has affected that decision. When you renew your scholarship, it's still $7,000 each year that you're in the program. Also, during the summer in July, the sponsor United Health Foundation invites all of our scholars to Washington, D.C. for a forum on Capitol Hill. They pay for everything for that for that. And so look out for an invitation. We'll be sending that to you once we receive that from the United Health Foundation. So I wanted to thank you guys again, and congratulations on being a part of this the scholarship program. If you guys have any questions for me, I'm going to unmute everyone. So questions for me or for each other, please feel free to ask. Hold on one second.
Hello?
Hi.
Hello. I have a question in terms of,
I'm sorry.
This is Raphael Harris. My question, it pertains to, I guess, the date at which we need to have all the hours completed.
Okay.
Like it's because like I don't know what everybody else's start timeline was, but I didn't get the acceptance or start until the end of January. And in the application, it said in the application we had pretty much from December to May to complete 200 hours. So I'm trying to figure out what's the day of which all of that needs to be done, because it's more condensed. Do you see what I'm trying to say?
Mm-hmm. We ask that the bulk of your hours be completed by May 1st. You should have enough to be able to begin your paper. If you need to extend your time pass, then you have until the culminating event in June 17th to complete the total number of hours.
Okay, well that's perfect. So I just didn't know if there was any range in that. So thank you for answering that.
Mm-hmm.
I had a question. This is Christian. For those hours, do we need any particular documentation? Is there a form that will be provided or signatures that are needed, that kind of thing?
No,
Oh, okay.
Go ahead. There's no form, but your mentor will report on the hours. They're asked to report on the hours in the post-program survey.
Okay. My second question is for the final paper that's requested. If, for example, we've finished a paper related to our project by that date and we're submitting it for publication, can that paper serve as the stand-in for that final draft, or do you guys want something more of like a narrative as opposed to a research paper submitted for that?
You can submit the research paper if you'd like, if it's condensed enough. I guess in our thinking is that this is not as detailed as the research paper would be for publication, but you can substitute it. That's fine.
Okay. And it's okay that paper is being submitted for publication at a journal or something of that nature. That's fine.
Absolutely.
Okay.
So if it's something that we can't publicize, you just let us know when it's available for us to be able to use. Because like I said, we do sometimes show off our students' work and we share it with our sponsors and stuff. So something that's in it being published and we can't share it, just let us know so that we can know when we're able to share it with our public.
Okay.
Does anyone else have any questions? No? Well, thank you all for taking the time to, out of your day to sit and listen to us. And if you have any questions, please feel free to send an email either to myself or to just the scholarship email box, which is answered by my colleagues Stephen and Tanikia. So thank you all for joining.
Thank you.
Thank you.
Thank you.
Bye.
Bye.